Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Last time we have discussed about the pathology of arthritis, dividing into inflammatory and non-inflammatory arthritis. Today we will be discussing about the features of inflammatory arthritis in little more detail. So inflammatory arthritis is most often it is an immune mediated problem, and one of the important characteristic is morning stiffness. That is, the patient it takes some time or some only after some movement the joints become loose. So this usually lasts more than 30 minutes in inflammatory arthritis, and it improves with activity. And in addition, there will be other features of inflammation like swelling, warmth and erythema, and systemic symptoms like fever and fatigue are present. So inflammatory arthritis characteristic feature is morning stiffness. Morning stiffness only means that it is inflammatory arthritis, and as per Kelly's textbook, the definition is morning stiffness lasting more than 30 minutes is characteristic of inflammatory arthritis, and in rheumatoid arthritis it often exceeds 1 hour. So that is one point to be remembered. And again, remember, rheumatoid arthritis is not a arthritis alone. It is a systemic inflammatory disease. Various other organs, lungs, gagety, bones, eyes, etc. can also be affected. So this is one important point to be kept in mind in most of the inflammatory arthritis. This is in contrast with the non-inflammatory arthritis. The typical example is the osteoarthritis. It is a degenerative arthritis. Morning stiffness is present at all. It is less than 30 minutes. It worsens with activity, whereas in inflammatory arthritis, it improves with activity. There will be bony enlargement, crepitus, and no systemic features. Fever and other systemic features are absent, conspicuous by absence in non-inflammatory arthritis. Hope these points are clear to you. So now we take one case and explain. So this is a patient with a 42-year-old female with joint pain of both hands, that is bilateral symmetrical of 3 months duration, and has got morning stiffness lasting more than 1 hour. Has got a swollen PIP and MCP, proximal interphalangeal and metacarpophalangeal joints. Proximal interphalangeal joints and metacarpophalangeal joints. These are the classical features. Fatigue and low-grade fever. So this is an inflammatory arthritis. And the laboratory-wise, there is evidence of elevated ESR, CRP, and positive rheumatoid factor. And X-ray shows periarticular osteopenia and marginal erosions. This is typical of rheumatoid arthritis. So these are the X-ray showing there is a periarticular osteopenia and marginal erosions. So the key feature is it is symmetrical and inflammatory signs are there. So rheumatoid arthritis is the typical example of an inflammatory arthritis, bilateral, symmetrical. The joints affected are typically the proximal interphalangeal and metacarpophalangeal. It is a deforming arthritis. Now we go to the next case. It's a 65-year-old male complains of knee pain for the last 2 years. Stiffness in the morning lasts only 5 to 10 minutes. Pain worsens with walking and better with rest. No swelling or redness. Here there are no signs of inflammation. There is no morning stiffness, so this is a non-inflammatory arthritis. Typical example, this is the osteoarthritis. And the X-ray will show features of osteophytes, joint space narrowing, and subchondral sclerosis. So the knee joint is one of the common joints that is affected. So here, this is a normal joint space. Here the joint space are narrow, and there is a osteosclerosis occurring. So this is the osteoarthritis. So we have given two cases. One is a typical inflammatory arthritis, rheumatoid arthritis, and another is the osteoarthritis. Let us look a little more closely. So osteoarthritis is a degenerative arthritis. Morning stiffness is less than 30 minutes, and the distal interphalangeal joints are classically affected and there are nodules called Haberden's nodes. So these are the features of a. So I will repeat once more. Osteoarthritis is a degenerative arthritis. Morning stiffness is less than 30 minutes. There is Haberden's nodules. Distal interphalangeal joint, there is swelling and the nodule formation. So in a rheumatoid arthritis, it is a bilateral symmetrical PIP and metacarpophalangeal joints are affected more commonly and it is symmetrical. Here you can see it is a asymmetrical. So degenerative arthritis is asymmetrical. There is cartilage loss, so the joint space will be narrowed. Whereas the inflammatory arthritis, rheumatoid arthritis, it is inflammatory, most often autoimmune. The synovial inflammation is there. Morning stiffness lasts more than 30 minutes, and it is symmetrical, and extraarticular involvement is common. So hope it is clear to you what are the major differences between the osteoarthritis and rheumatoid arthritis. And this table summarizes the features. And the most important thing, remember the morning stiffness. In osteoarthritis or mechanical arthritis, is less than. Activity improves in inflammatory arthritis, worsens with use in mechanical arthritis. Joints affected are small joints. Here the large joints like knee joint is common. Inflammatory signs are present. Laboratory findings, the ESR, CRP is elevated and systemic symptoms are common. And it is more often seen in younger people, whereas the osteoarthritis is more common in the elderly. Hope the difference between inflammatory and non-inflammatory is clear to you. The clinical words that you should keep in mind is always ask about morning stiffness and pattern of pain. Morning stiffness only means that it is an inflammatory arthritis. It doesn't mean that it is rheumatoid arthritis. Inflammatory arthritis is often symmetrical, small joints are affected. Mechanical arthritis is asymmetric and it is localized. And laboratory findings will help to differentiate between inflammatory and non-inflammatory. So today we have discussed about the inflammatory, non-inflammatory and given two examples. Inflammatory, the classical rheumatoid arthritis, and in the non-inflammatory, it is a osteoarthritis. Hope it was useful to you. Next session, we will be discussing the other types of arthritis, that oligo and polyarthritis. Hope it